Good morning. If you have decided to study to become a professional hypnotherapist, continue with us in this beautiful project of study and learning. Hypnosis is a powerful technique with which you will be able to help and improve the quality of life of a great number of your future patients. Remember, study the description of this video where you can find a link to free clinical hypnosis training classes with several free ebooks. Let's see first a diagnostic summary of a patient with a nicotine problem. We can see different information related to music we are going to use, the treatment and technique we are going to use. Smoking cessation treatment and script. Clinical case example: nicotine dependence. Patient X66. Diagnosis: DSM-We. X61. Nicotine dependence. X62. No. X63. No. X64. His younger brother. X65. EEAG 90. Sessions 2-3. CD. Relaxation music. First group and second group. HPC's methods and key. Third group. Treatment. Cognitive. I want you to visualize yourself as a woman who smokes a lot, who abuses tobacco, who has been smoking for a long time, who finds it very difficult to quit on her own, who lives for tobacco. All this happens to you because of the anxiety you have. That anxiety comes from the hectic life you lead, from the high concern you have for your brother, from the burden of carrying everything. Behavioral. From now on, I want you to be a bit selfish, in the sense that you're going to look after yourself more than others, in the sense that you're going to take good care of yourself. From now on, you're going to live in a calm way, relaxed, serene, very serene. From now on, you're going to take good care of your health. You're going to take good care of your lungs, your breathing. From now on, you're going to stop smoking. The company, your son, your husband, your brother, they all rely on you. They all count on you. If you fail, they go down. If you die, they go down. If you keep smoking, you will die. You will die in a disgusting way, suffering a lot, drowning in your own snot, searching for air. You will leave your family, your brother. Without you, everything sinks. From now on, and on you, will never smoke again. From now on, only air will enter through your lungs. They need you. Aversive 1. I want you to visualize yourself smoking, never stopping smoking, coughing, never stopping smoking, choking, never stopping smoking. I want you to visualize how you eventually develop cancer. I want you to visualize yourself in the hospital. You are in the terminal phase, trying to take a mouthful of air. Hardly any air gets into your lungs. I want you to feel yourself drowning in your own fluids. It's a horrible death. You die. You die. You leave your husband. Your husband goes into a deep depression. Your son is looser. Little by little, as he gets looser, he gets into drugs. Your brother goes crazy in the company. He ends up closing the company. The employees are left in the street, unemployed. Your brother returns to drugs. He ends up being a social wasteland. Your husband with a strong depression from which he ends up committing suicide. Your son ends up being a drug addict. He has lost everything, everything because of the damn tobacco. From now on, you're going to fight so that all this is just a dream. To prevent it from happening, from now on, you totally stop smoking. You hate tobacco. Tobacco wants your ruin and the ruin of your family. From now on, you'll never smoke again. Tobacco is over forever. Now, you welcome life, joy, health, family togetherness, love. Aversive 2. First, we must find out which taste the patient dislikes the most. In this case, it is the taste of nolotil, which is analgesic. Secondly, we have to make the patient relieve this taste under hypnosis. And thirdly, we apply the aversive exercise. I want you to feel in your mouth the disgusting taste of nolotil. Concentrate and feel that taste. Notice how disgusting it is. You feel in your mouth the taste of nolotil. It is disgusting, unpleasant, nauseating. You can't stand it. You feel like vomiting. It is disgusting. From now on, every time you light a cigarette, it will have a strong taste of nolotil, so strong that you will be unable to continue smoking. From now on and onwards, every cigarette you light and smoke will taste strongly and unpleasantly of nolotil. You will feel watched by others. Others look at you smoking and see you as a sick person, a drug addict. From now on and onwards, every time you smoke, tobacco will taste like nolotil, and you will feel watched by everyone, criticized by everyone. Self-concepts. I want you to visualize yourself in a shop where there are a lot of people, where there are children. You feel like smoking. You light up a cigarette. See how the others look at you. They all reproach you for smoking in a forbidden place. They look at you as if you were a stinker. In the end, they throw you out into the street, and you smoke your cigarette in a corner, where you see yourself reflected in a shop window. You see yourself smoking as if you were a drug addict. You have been thrown out on the street. Everyone looks at you. You look like a sick person smoking, a stinker. You disgust people. Look how you have ended up. Look how others see you, how they look at you. self-control. I want you to visualize yourself as you have been smoke-free for several days. This makes you feel good, very good, getting better and better. We are getting ahead of ourselves. You have been smoke-free for several months. You feel better and better. You breathe more smoothly, more deeply, without any effort. Take a good look at yourself. Your face has changed. You feel much better. 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 Your chest is clear, very clear. You are calmer, much calmer. You feel proud that you have quit smoking, very proud. Now you know that you can control this situation perfectly. You have mastered your addiction. You are strong, very strong. Now you know that you can control this and everything you set your mind to. You know that you have great self-control. Self-esteem. I want you to visualize yourself as you want to be, as you would like to be. You know that you are a hard-working woman, very hard-working, good wife, and very good mother. You know that your son comes first. You want to give him a good education. For that, you must give him an example. And what better example than to see that his mother has stopped smoking. Post-hypnotic order. From now on, and from now on, you will never smoke again. From now on, you are giving up tobacco for good. You will never smoke again. This makes you feel good, very good. You feel very proud of the decision you have taken, of the decision to give up tobacco, of the decision to never smoke again. From now on, you will live without the need to smoke. You will never again try a cigarette, never again. Now a new life opens before you. A life without tobacco. A life without smoking. A life without smoke. A new life, full of illusions, full of new projects. Now you feel good. Now you're better with your husband, better with your son. Now you're leaving tobacco for good and for good. Whisper. Listen and feel my words whisper in your ear. Engrave in fire every word I whisper to you. Embed every word I whisper to you in the deepest part of your mind. Listen and feel everything I'm going to tell you, like a soft and pleasant wind that whispers among the leaves of the trees. Life is a matter of priorities, and your top priority is to recover, restore you, heal you, and conquer all your fears. I have given everything to help you. Now, I'm only waiting for you. Everything depends on you. If you want, you can. To want is to be able. And you want to recover. You want to restore you. You want to heal and conquer all your fears. You are going to get it. You deserve it. Secondary exercises. all positive and mirror. Completion. Let things happen. Let yourself go. Let them happen. 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 Already happen without forcing anything. Let things happen. Key. The next time you come to the consultation and I tell you the keywords that will act as a key to enter into this state so deep in which you find yourself. In which you find yourself. As soon as you hit the key, you will enter an even deeper state than the one you are in right now, much deeper. You know that your key is Assam. Memorize these words in your mind. Embed it in the deepest parts of your mind. Burn it into your mind. It is your key. Exit. Now, I'm going to count to 6. And when I say 6, you will open your eyes. And you will feel wonderful. You will feel new and refreshed. Above all, you will feel very relaxed. And you will remember everything that was said in the session. The order you have for this week is that you have less and less desire to smoke. 1. You have less and less desire to smoke. 2. You feel less and less like smoking. 3. You feel less and less like smoking. 4. You feel less and less like smoking. 5. You feel your whole body, everything. 6. Open your eyes. If you're interested in learning more about clinical hypnosis, watch our next video, Self-Instructions. Remember to study the description of this video, where you can find a link to free training classes about clinical hypnosis, with several free ebooks as well. If you have questions, ask them in the comments area. On this topic and many others, we'll talk about in the channel and in the videos that we'll publish. So, if you're interested, don't miss our next videos. Thank you very much.